So here at the John Ball Zoo, when we are looking out for the health of all of the animals here, over 1,000 patients, we have set ourselves up with a pattern each week where we do our veterinary rounds every Monday. That's my first day here during the week. It allows me to catch up on anything that's happened during my weekend, but it's also our point where we get to touch base with all of the zookeepers in each area of the zoo to be able to check in on patients that we're either monitoring for conditions that are undergoing treatment or just need to be rechecked. During rounds, we'll stop with some patients. Our larger animals here at the zoo, we rely really heavily on training because unless we're doing full anesthesia for their physical exams, we're not going to be able to go in with those. So when we're visiting animals like the chimps or the bears, the keepers will often do training sessions with us to allow us to build a relationship with them, allow the animals to trust us, as well as allow us to check on things, whether we're looking in their mouths or checking on a cut or a scrape. We can do that during rounds very easily using training. So in some cases, we're checking on patients after they're recovering from procedures or surgeries. This week, we had 3 patients in particular that we were checking for post-op surgical rechecks. That involved looking at incisions on Sirius, one of our domestic rats, as well as Carl, one of our eastern box turtles. Both of them had cancerous tumors actually that we found during routine exams and removed those, and are finding that the surgical removal has been quite successful so far. So that's been really good to see them recovering smoothly from surgery. So on rounds, while we're doing a lot of rechecks and conversations with keepers, we are occasionally doing hands-on procedures with animals as well. So in this case with our emerald tree boa, she actually needed some medical treatments performed, and that included giving her both oral medication as well as injectable medications and fluids as we're treating her for some dehydration issues. So we're kind of ready to jump in and do those things in addition to just checking in and doing some simple rechecks on rounds.